and thank you for joining us today on SpEd. On our show today, we have Dr. Andrea Walbrook. She is a clinical speech pathologist, and she's also the owner of Your Speech Therapy Solutions. And we want to thank you for being on our show today.
Thank you.
We want to touch base on some questions that our viewers have in regards to speech pathology. But before we do that, I would like to ask you a little bit more about as far as your history and background on how you became a speech pathologist.
Well, I want to thank you in advance also for being able to share this information with the communities and your viewing areas. I decided to study speech pathology from a friendship that my mother made in college and in graduate school. She enjoyed special education, and I got an opportunity to study with her and be a volunteer with her as a speech therapist. So as a volunteer as a speech pathologist, and then an opportunity to attend North Carolina A&T, Appalachian and Howard, I stayed on that path of speech pathology, and it's been a great path to be on for almost 20 years now.
Now, I understand that you're also as far as a professor at Howard University as far as with their speech pathology program.
Yes, Howard University has an awesome part of the communication sciences and disorders in our community. They provide speech-language pathology services as a clinical experience and also as graduate studies. I've had an opportunity to be a clinical supervisor, extern site, and also teach at the campus. But now my role is a clinical supervisor, and that means students come out into the community, different facilities, school system, nursing facilities, and I provide their clinical supervision, which is a great service back because Howard University was where I attended to get my PhD.
Now, as far as a lot of parents have, as far as this main question, what's the difference between language therapy and speech therapy?
Okay. There are two different and separate entities for sure. Speech is how we make sounds, like R's, K's, T's, D's, the sound production. Language is how we process information or we express our ideas. For example, questioning, finding out information will be receptive. Expressive communication is how we tell our needs and wants to others. Children and adults can suffer with a child language or an adult impairment, which impacts speech, for example, fluency, speech production, articulation, or language, which is a language disability. In both of those areas, you have language is how you process and how you give information back, and in articulation is how you produce sounds.
Okay, so can you give us some examples of what exactly you mean by articulation therapy?
Okay, articulation therapy is when you have children or adults have a difficult time producing certain speech sounds. For example, there's a developmental area, or I guess I want to say a period of time where you can see a non-developmental error or a developmental error. For example, in pre-kindergarten, preschool, and kindergarten, you might have a child that says W for R. I really want to see that wabbit. And you're like, that's an R sound. That's articulation, for example. But it's non-developmental. That means if it's a sound that you should have at a certain time, you should be able to produce it, or it's developmental, and you know, for example, they should be able to produce that sound.
Now, what about fluency?
Fluency is, for example, disfluency. They call it stuttering. That's the word, more layman's terms, is stuttering. Disfluency can be, there's some stories about disfluency. Let's put it this way. The foundations or the expectation that disfluency is something that can be from your family members, from a trauma, from just childhood language development or articulation. But fluency is under that umbrella of the speech portion, not just language. It's the speech production. Something has happened where the speech is not fluid.
Voice.
And voice. Now, that's been unique for us. We have issues at Howard University where we have children with vocal nodules. That could be in a situation where their voice is a lowered tone or there is not a crackly sound. That can happen too with adults after a stroke. So we have stroke support groups that deal with voice, and we have children that we deal with voice treatment.
On the language side, as far as we hear a lot, especially with autistic children, about receptive language. From a speech standpoint, how would you define receptive language?
Okay, receptive language, and that's one of those things where you see these three circles, and it's something you learn in graduate school. It's the three circles of language: form, content, and use. With autism, all three of those circles are impacted. For example, the form of language, the content of language, and the use, particularly use, social pragmatic language for autism students. Children that present with autism usually have pragmatic concerns, turn taking, how well I talk, you talk, eye contact, things like that. So autism has a tremendous amount of the social paradigm impacted usually. But remember, autism is a spectrum. So some children have some portions of it and some don't.
And what about expressive language?
Expressive language from the autism community could be nonverbal. It could be needing the voice output device. It could be a static device. It could be AAC, which is augmentative alternative communication. They might need that as a resource or a way to produce their speech with others.
Now, why as far as the difference between having language and speech therapy? How is there a big difference between the two?
Mm-hmm. Well, speech therapy deals with intelligibility. It deals with intelligibility of the speech sound, how someone understands. If it's unintelligible to the listener, they don't understand what you're trying to say, that's artic. Language-wise, it's getting your needs and wants. Suppose you have a child that presents with autism and they can't express their needs, food, toileting, bathroom, sadness, fear. They can't express that for language. That would be a difficult situation, and that is where we have an impact with our children.
As far as when we come back, I want to talk a little bit more about apraxia and also feeding and swallowing and maybe some assistive technology, and we'll do that right after this.